Acute renal failure. Acute renal failure is a critical condition that occurs when the kidneys suddenly fail to function. The kidneys play a vital role in the excretory system, responsible for eliminating waste products and regulating the body's water and electrolyte balance. When acute renal failure occurs, it disrupts these essential functions, leading to severe consequences. However, with timely medical intervention, this condition can often be reversed. Acute renal failure, also known as acute kidney injury, is a condition in which the kidneys suddenly stop functioning. The role of kidneys. The kidneys are crucial for eliminating waste products from the body and regulating water and electrolyte balance. When the kidneys fail, it disrupts the fine balance of the body's systems and can lead to severe consequences, including end-stage renal disease, uremic syndrome, and even death. Uremic syndrome. Uremic syndrome is a condition that may appear in the late stages of renal failure. It leads to the excretion of waste products through the skin, causing a characteristic white film to form on the skin. Classification of acute renal failure. Acute renal failure can be classified into 3 categories: prerenal failure, intrinsic or parenchymal failure, and postrenal failure. Prerenal failure. Prerenal failure is characterized by diminished blood flow to the kidneys, which can result from various factors, including hypovolemia, shock, abdominal fullness, blood loss, sepsis, and cardiovascular disorders. Intrinsic or parenchymal renal failure. Intrinsic renal failure is caused by damage to the kidneys themselves, often due to acute tubular necrosis. Possible causes of this damage include sickle cell disease, glomerulonephritis, pyelonephritis, and ischemia. And postrenal failure. Postrenal failure is a result of obstruction of urinary flow, typically caused by factors such as kidney stones, blood clots, tumors, papillary necrosis, and urethral edema from catheterization. Signs and symptoms of acute renal failure. And see, early signs of renal failure may worsen if the kidneys do not recover. Symptoms can affect various body systems. Symptoms in the gastrointestinal system include anorexia, nausea, vomiting, diarrhea or constipation, stomatitis, bleeding, hematomasis, dry mucous membranes, and uremic breath. Renal failure can lead to symptoms in the central nervous system, such as headache, drowsiness, irritability, confusion, peripheral neuropathy, convulsions, and even coma. The integumentary system, which includes the skin, may show signs like dryness, pruritus, or itchiness, pallor, purpura, or purple spots, and rarely uremic frost, the white film on the skin. Cardiovascular symptoms may start with hypotension and progress to hypertension, dysrhythmias, fluid overload, congestive heart failure, systemic edema, and anemia. Respiratory symptoms can include deep or rapid breathing due to metabolic acidosis and occasionally pulmonary edema. For medical professionals, the most commonly observed signs and symptoms of acute renal failure include mental disturbances, decreased urine output, respiratory conditions, cardiac problems, fever, and chills. Treatment of acute renal failure. An intensive care unit treatment for acute renal failure includes several key steps. Patients are typically started on intravenous 0.9% normal saline to support kidney function. Monitoring urinary output is crucial, and hourly checks are necessary to assess kidney function. Fluid intake may need to be restricted to manage the patient's condition effectively. In some cases, medications are not recommended, and the focus is on other treatment options. If necessary, hemodialysis, a process that removes waste materials and poisons from the blood using an artificial kidney, may be employed to support kidney function